Hello everyone. On the occasion of World Brain Tumor Day 2026, our message is know the signs, act early and protect the brain. Hi, I'm Shivani. I'm the psychologist at Chinmaya Mission Hospital. In my practice, I often see patients coming with persistent complaints of headaches, memory difficulties, cognitive difficulties, personality changes, emotional disturbances, and many such. When these symptoms may be related to psychological factors, it could also have an underlying neurological condition as well. To understand this better, we have Dr. Kiran M, a senior consultant neurosurgeon and head of department neuroscience with us to help us understand a little bit about what brain tumor could look like. He has over 20 years of experience in the field of neurosurgery and he's also part of many neurological societies. We are honored to have him here today. Hello, sir.
Hello, namaste.
Yes. Just to understand a little bit about exactly what brain tumor is, can you help us understand what brain tumor is?
Tumor basically means abnormal cell growth. That means like all cell growth in our body is normally regulated, but unregulated cell growth becomes tumor. There is a misunderstanding that all tumors are cancer. No. Cancer means it is an extreme form of unregulated growth. So any swelling, like sometimes you see in the skin here swelling, similar to that, you will have many swellings inside the brain or abnormal growth. These are called as brain tumors. It can be in the upper part or it can be behind the tumors. So there are many types of tumors are there. Only very small percentage are cancers. And another good thing about brain tumors is they do not spread to other areas. Like how if you have a lung cancer or stomach cancer, it spreads to the brain or it can spread to other organs. But most 99% of the brain tumors, even if we say cancer in a normal word, they do not spread to other areas.
Yes, just to understand a little bit, what could be the early signs and symptoms of brain tumor?
Yes, it can be different symptoms. One of the common symptoms is headache. Like headache, everybody who has head has headache. That is what people say. But all headaches are not tumors. So less than about say 0.01% may have tumors. But important thing is this forms one of the early signs or symptoms. So it is very important to recognize it. For example, a patient has got headache which is coming on and off. He never had a headache before, but it has started now. Say, I have a doctor, I have since 3 months I have a headache before I never had, and it is coming every day. Sometimes it is associated vomiting, and these kind of things we should investigate. Not all, some may be tension headache, as you have seen in your practice. Most of the headaches do not have tumor underlying them, but it is better, like if you have headache which is persistent for more than 1 month, and if you have headache which is increasing in frequency or severity, it is better to always consult doctor.
Are seizures also an important factor?
Yeah, it's a very good question. Seizures also can be a symptom, but some of the seizures, like for example in children, when they have a seizure, most likely it is because of some brain abnormality. It may not be. But if an adult, say about 40-year-old person or a 50-year-old person, has a seizure first time in his life, then that could be an indication of a seizure. Apart from that, some type of seizures are there, like it will start with one side of the body, what we call focal seizures, and spread to others. These all can have tumors underlying. Apart from that, they may also have other symptoms like mood swings, change in behaviors. I had a patient whose husband used to be very docile, used to sit and read newspaper and all those things. Suddenly, over 2 months, he started beating his wife. Then they came ultimately, luckily instead of going to court, they came to the hospital and it was detected to have brain tumor. And some of them can have other symptoms such as weakness of the hand, legs, or vision changes. These are some of the other symptoms with which patient can have.
What is the risk of brain tumor?
See, there is always, before there is a stigma or a bad notion that brain tumor means, it's a bad thing. And of course, all tumors are bad. But good thing is that with the modern advancement, whether in the science, whether in the facilities available, good anesthesia and understanding of the anatomy and other things, we are able to treat more than 95 or 99% of the tumors safely. As I've told before, these tumors do not spread to others areas, and not many are not cancerous. So when these are detected early, detection is the key. And first surgery or first treatment is always the best treatment. And when it is diagnosed properly and treated, most patients go back to their life and lead normal.
How is brain tumor usually diagnosed?
Usually brain tumor, when they come with symptoms, normally we analyze them. If they have, as I told, if they may be having some features like they may have mild weakness, or when we test them, they have cognitive disabilities, speech disabilities, and all those things. And those, when we detect some of the symptoms, what we call the increased pressure or ICP symptoms, when these are diagnosed, we do what is called as imaging of the brain. Most commonly we do MRI scan. Apart from that, CT scan also done. These are the common modes by which we diagnose. Once we diagnose it to have a tumor or these things, based on where their locations, there are many other tests like blood tests, hormone tests, other things to further evaluate the tumor.
Since you also have experience with minimally invasive techniques also, is brain tumor also treated with minimally?
Yeah, in fact, most of the brain tumors nowadays are treated with a minimally invasive methods. The minimally invasive, like we use what is called as navigation, just like how we use navigation for Google Maps and other things. We do a scan, and those images are put into a special equipment called navigation, and that can localize the tumor exactly to the millimeter accuracy. So once we know that area and what all the important areas are surrounding it, we do what is called a small craniotomy or opening, and then go and remove the tumors. And also some tumors like pituitary, you must have commonly seen they present with infertility or suddenly change in body habits, suddenly they put on weight and those kind of things. Those people, even without opening the skull through nose, what is called as endoscopic surgery, we can do and operate on them. And key about minimally invasive, what I call, is not just about making small incisions, it is about good outcome. Without causing or least collateral damage, we should be able to operate these tumors so that they go back and lead normal lives. And for that, we have many other facilities, such as I told, navigation. We have intraoperative nerve monitor. That means we put a monitor, and it will show if we are very close to the important area like speech area or motor area, that is hand area or leg area, so that, and we can stimulate and check so that that part can be saved. Or some people you must have seen like what we call as acoustic tumors, that is they come with the tumors arising from ear nerve. So those people, the face nerve and all is very close to that. So we put nerve monitoring and save these face nerve. Before about 20, 30 years back, many of them, this facial palsy was norm, but now it has become rare. Such that after surgery, many patients, you see them, you don't know, even scars won't be visible. You find whether they have been operated at all. So that is the good thing about advancement of science.
Very insightful knowledge you have shared. On the occasion of World Brain Tumor Day, is there any message that you would like to give the public?
Yeah, about 28,000 people are detected with brain tumors every year in India. But unfortunately, many of them are diagnosed late. So my request or appeal is patients with headache, with are not resolving in a week, or patient has got seizure, new onset seizures, or patient has sudden put on weight, or any like change in behavior, these kind of symptoms are there, please seek medical help early, because with early diagnosis and proper treatments, these patients can live normal life. So my appeal to you is to seek medical care early. Thank you.
Thank you, sir. Thank you so much for sharing your knowledge.